Hi everyone, thank you all for joining. Today we have the great honor and privilege of having Miss Heidi Onda and Dr. Pierre Onda with us. Heidi and Pierre are high school sweethearts since 1979 and married 36 years. They are the co-founders of the White Ribbon Project, which aims to change the public perception of lung cancer with the message, anyone with lungs can get lung cancer and no one deserves it. Heidi, a lifelong health enthusiast with no smoking history, was diagnosed with stage IIIA cancer of the lung in October of 2018. Pierre is Heidi's caregiver and a recently retired primary care physician. Lung cancer rocked their world and they're fighting back strong and encouraging the lung cancer community to unify, stand tall, and increase lung cancer awareness by becoming visible and vocal, humanizing this misunderstood disease. They're joining us today with the American Lung Cancer Screening Initiative to share their story. Heidi and Pierre, thank you so much for your time and willingness to be here with us.
Thank you.
Yes, thank you.
Before we continue, we want to launch a quick poll to get a feel of the audience we have today. And we have two questions asking how much you know about lung cancer and lung cancer screening. So I'll launch the poll, and if everyone could take a couple of minutes to fill it out, that'd be great.
I'll let you.
Okay, I think we're reaching a lot of our responses, so I'm going to end the poll and just share the results. But it looks like we have a good mix of people in the audience today. Some people know a lot about lung cancer screening. Some people know a little bit, and a few people don't know much about both topics. So great to see that we have a diversity, and we hope that through this podcast and the topics that we discussed today, people will be able to learn more about both of these topics. And to introduce myself and my team, my name is Priyanka Senthil, and with me I have Anish Gugilam and Drake Wong, as well as Alexander Potter. And we are part of the American Lung Cancer Screening Initiative, or ALCSI for short. And for those who might not be familiar with our organization, ALCSI is a nonprofit organization working to raise awareness about lung cancer and lung cancer screening. And I have a couple of slides to talk about who we are. So hopefully everyone is able to see my screen. ALCSI is a team of over 200 students and doctors located across the United States. And we do the work that we do because lung cancer is the deadliest cancer in the world, causing more deaths than breast, prostate, and colon cancers combined. Lung cancer causes about 380 deaths per day in the US alone. And lung cancer is very fatal because currently many patients are being diagnosed at a late stage when the cancer has grown and spread to other parts of the body. Lung cancer screening is an effective imaging technique that can be used to screen for lung cancer and has been shown to catch lung cancers early. However, less than 6% of people at high risk for lung cancer are currently getting screened. The screening rate for lung cancer is much lower than the screening rates for breast, cervical, and colon cancers, which are about 70%. We believe educating people about lung cancer and lung cancer screening is one of the most important and effective ways to increase the screening rate for lung cancer for populations that would benefit from lung cancer screening. So far, we have given over 120 presentations on lung cancer screening to universities, hospitals, medical schools, and organizations around the US, as well as India, Canada, Brazil, and Mexico, reaching over 10,000 people. Over the last year, we worked with 105 mayors from every single US state to issue proclamations recognizing November as National Lung Cancer Awareness Month. And we've also had the opportunity to work with several state leaders at the state level, including Arizona State Senator Leila Alston, who is a lung cancer survivor, and Pennsylvania Governor Tom Wolf, as well as the Lieutenant Governor of Colorado, Diane Primavera. In addition to our education, outreach, and advocacy efforts, we recently started a podcast series to share the personal side of lung cancer and provide a platform for lung cancer survivors and advocates to share their stories. And ALCSI has also worked with US Congress members and senators to draft and advocate for the first ever House and Senate resolutions recognizing the importance of the early detection of lung cancer through screening. And in December 2020, the Senate resolution was passed with unanimous consent, marking the first time the US Senate has ever recognized the importance of screening. ALCSI has also actively been working with Representative Brendan Boyle and Senator Tina Smith to draft and advocate for Catherine's Law for Lung Cancer Early Detection and Survival Act of 2021. Lastly, we want to end by talking a little bit about lung cancer screening. Lung cancer screening is done using a low-dose computed tomography scan. This scan uses low radiation doses, it's pain-free, and takes less than 5 minutes to complete. The United States Preventive Services Task Force, also known as the USPSTF, sets guidelines for who should be screened for lung cancer. Right now, they recommend that people between the ages of 50 and 80 who have a 20-pack-year smoking history or more, and who are current or former smokers who quit within the past 15 years, get annual low-dose CT scans. 1 pack year is defined as smoking on average 1 pack a day for 1 year. Therefore, 20 pack years can be met in a multitude of ways, including smoking 1 pack a day for 20 years or smoking 2 packs a day for 10 years, for example. Well, thank you all for taking the time to listen to that presentation. And without further ado, we can jump right into the podcast. We have a few questions prepared for Heidi and Pierre, but we also have a Q&A session at the end where you all can submit any questions you have for them. And this podcast is being recorded and will be shared on our Spotify, Anchor, Google, and Apple podcasts, as well as our YouTube channel. The first few questions are targeted towards Heidi to get to know more about her diagnosis and experience of receiving the diagnosis, but Pierre, feel free to jump in and add anything you'd like to share. So first off, Heidi, could you please introduce yourself and share your background?
Sure. My name is Heidi Nafman-Onda. I am a lifelong health enthusiast, a fitness trainer, and a health educator. And I was blindsided, my whole family was, by my stage IIIA lung cancer diagnosis about 3.5 years ago. I had no known risk factors and I didn't have any symptoms. So while investigating another issue, a CAT scan was ordered for my chest, abdomen, and pelvis, and then they found a mass in my left lung in the upper lobe and some swollen lymph nodes in the middle of my chest. So that was the beginning of just a whole new life. We were shell-shocked, and we just couldn't believe what we were hearing as a family.
Yeah, we were both shocked, and I'm a primary care physician, and of course I was familiar with lung cancer, but I have to admit that I really was not aware of the risk in people without a history of smoking, and wasn't really aware of other risk factors for lung cancer. So it was quite a shock for both of us.
I mean, I can't believe how surprising it was finding out that you had lung cancer. You seemingly very healthy. You said you're a trainer. But what was the experience like when you received your lung cancer diagnosis, and what was going through your mind?
Yeah, when I first, again, this happened over the phone. So it was, and I knew the call was coming. I knew I was going to get some results, but I was really just in total shock. I remember just screaming and like, what? I mean, how could this be? And the other part of me was thinking, I better not go into denial because this is serious and I want to get this taken care of, quickly before it spreads even more. So I was kind of in panic mode. And the first thing that went through my mind was my husband, Pierre, doesn't know how to pay the bills. So I need to show him how to do that right now. I had to, I went to the filing cabinet and I took out, all passwords and so forth and so on, because I was just thinking about, wow, I was told that this was terminal, even at stage 3, because it was inoperable. And there really weren't any treatment options for me because I didn't have a targetable mutation. So we were really just shell-shocked. And then when I met my oncologist, though, we were given so much more hope. He told me that there was a new immunotherapy that had just been FDA approved about a month prior to my diagnosis. And after chemoradiation, if I didn't have any progression, I could qualify for this immunotherapy. And I did really well through chemo radiation. Tumor regressed quite a bit. And then I had a year of these immunotherapy infusions every other week. So, and for a year, and I have no evidence of disease since, I finished all those in January 2020. So, I go back and I think about, getting the worst news of my life and then speaking to an oncologist and learning, well, gosh, there is a lot of hope. And why didn't the pulmonologist know that? So that kind of struck me that, a lot more awareness is necessary. Here we were, a fitness trainer and a health educator and a primary care doc who really didn't know. And then we had a pulmonologist who's an expert of the lung who didn't know about these new innovations. So it was head spinning the entire, those first, I would say, few weeks. And I mean, it's traumatizing, for not only me, but, my husband, my caregiver. He has to deal with, similar set of emotions, although he is not, directly, experiencing the lung cancer. Believe me, it does reach him and our 3 adult children as well. So it's quite an impact.
Describe the experience as, head spinning and truly traumatic. So could both of you please elaborate on like how your life changed after you're being after the diagnosis? Because obviously it's life changing. So could you guys please talk through like what were some of the things you felt? And yeah.
Well, for me, again, getting, affairs in order was really important. I wanted Pierre to be able to not be traumatized again if I did, pass within 4 to 6 months, that he would, have the tools he needed just to, get through, the household and so forth. And I started to prioritize things a little differently. It was really important to me to do the things that I wanted to do between treatments and not get so hung up on the small stuff. And for me, my priorities were, spending more time with my family. My kids live in different parts of the country. And prior to the pandemic, we really actually started to have a lot of fun. We planned a lot of trips, and I would literally leave an infusion because I had to have them every 2 weeks. And we would go to the airport and take a planned trip and have a wonderful time, and then come back and get ready for the next infusion, and then visit our kids. And so, we made our list of the things that made us happy, and just maximized the time, maximized precious time. And that changed dramatically when, the pandemic hit and we were all, forced to be home. And that was traumatizing in itself, because initially when all this hysteria was out there about ventilators and so forth, the lung cancer community was, really concerned that we wouldn't even get triaged if we needed a ventilator, because, we had lung cancer, a terminal illness. And what it is becoming, and what I hope to see happen more, is that it becomes a chronic manageable condition, just like many other diseases. And I'm almost 4 years out, and I'm not supposed to be here. And I'm not the only one who's doing well on this immunotherapy.
For me, actually, the paradigm shift in my outlook and my general well-being occurred actually the day that the results of her incidental scan came up, because her obstetrician, who had ordered her scan for other reasons, was trying to reach her, couldn't reach her. I worked in the same office. I had HIPAA release, so he was permitted to contact me since he couldn't contact Heidi. And he told me, look, the radiologist sees something suspicious in her lung. And he read me the report. And some of you have medical backgrounds. Radiologists, if they'll either call something definitively, this is cancer, or this is possibly unlikely. I got highly suspicious for, a malignant lung cancer. He used malignant, adenocarcinoma, but highly suspicious. So for me, that was the moment where, and then he mentioned that there was some enlarged lymph nodes in her chest. So for me, it was really at that moment where I said, yes, theoretically, there's some other possibilities, but this is lung cancer. And I remember instantaneously realizing I've got to focus on informing her, taking care of what's the next step for us. And I became immediately dysfunctional and blind to everything else, which was really, I had patients in offices. So I had to go to my chief, tell them, I can't continue here. I have to stop because I clearly felt that I would be a danger to my patients, because that's how much I was affected. And what I quickly realized later on was that I needed to actually seek some counseling to ensure, hey, am I capable to do my job? And I did that initially, but now in retrospect, I probably should have continued on. I went for a couple of sessions just to think, hey, am I okay? And after a few sessions, I said, okay, I can function and I'll adapt. But the reality is, for me personally, and I believe for many other caretakers, and for that matter, people who are diagnosed with a serious medical condition, that there's a lot of benefit, I think, to getting help, outside counseling, because it's a new experience. Certainly something for us that was new. And despite all of our coping skills and belief in our own ability to take care of ourselves, I think what we found out was it really did affect us and our kids and our circle of friends more than we had anticipated. And so that's my cautionary tale, is that maybe not for everybody, but when people are diagnosed like this, it really, most people don't have the initial skill set to navigate that. You can get through it, but what you want to do is get through it effectively and sort of move on quickly to more functional coping mechanisms.
And I'd like to just jump in real quickly about this too, is I was initially introduced to a social worker who was wonderful, but I tend to do better in situations like in a support group. I was looking for other patients, maybe with my diagnosis, because I was told 3A is, I mean, it's either 1 or 4 pretty much. And there was, and I would ask my physician, who was wonderful, and the nurse navigator, is there a support group? And I was like, no, we don't have that. And I go, well, what about outside of, this medical center? And well, there's, they would even say there's American Lung Association, and, but we don't think you're going to fit in there because you didn't have the risk factors. And so I just sort of took that as, wow, I'm really alone in this. And so is my husband. He has no connection to another caregiver. And again, I don't want to speak for Pierre. Maybe he would, prefer the way he went, but, with a counselor. But there's something to be said for finding somebody who's walked that path or is walking that path at the same time, that you can relate to one another. And I just found, like, when I would sit in the treatment waiting rooms or the, infusion lounge, there was information for all other cancers in terms of, support groups for other types, but zero, absolutely nothing for lung cancer. And it really, it just made me feel even worse. And then as I learned more that it was the #1 cancer killer and starting to put all the pieces together, that turned to anger, and we need to do something about this. So it's basically affected me, and I was very much an introvert and now not so much, because it's not serving me well to be quiet about any of this.
Thank you guys so much for sharing all of that. I know it takes a lot of vulnerability to come out and share such a personal story so publicly, but we really appreciate it. And I know a lot of people are being helped just by hearing your story. I can't imagine the shock following the diagnosis. It must be a lot of information to take in and scary when the future is unclear. But as Pierre and Heidi, as you mentioned, I think counseling and support groups can really help. And I know some people are hesitant about joining support groups or going to counseling, but a lot of patients have said that they found it extremely necessary and haven't realized how much they really needed it until they actually go to a session. And
Yeah. Yeah, I just wanted to say, you don't need to feel as that, well, I'm not sort of cowering in a corner, disabled, so then I don't need counseling. Really, it is about leveraging the resources available to make the journey less painful for yourself, and actually where you can become much more functional. If you're the caretaker, you can help the person who's been diagnosed, and vice versa. I still rely on Heidi for a lot of support.
And as much as, we're in love, we had our 36th wedding anniversary yesterday, and he's my soulmate since high school. There are certain things that I just know that another cancer patient going through the same thing is going to relate to better. And does this information or what I'm feeling actually help Pierre then if I, want to vent something? Or is it better to have somebody who was on the same treatment, or is feeling the same sense of loss of their own old life, and almost a guilt that even though we didn't cause this to happen in any way, no matter your health habits or not, cancer is cancer, and it just hits people and we don't know why. We just don't. We can't just say everything is cause and effect. We don't know. And gosh, did I do something? Should I have known? Boy, I should have known about radon, ahead of time. And it's all my fault that now my family is going through emotional, distress because I got cancer. And it's just not a good place to be. It's a dark place, and finding another, support system, other, like I said, survivors, or the social worker, or whatever the forum is. People with lung cancer need that too, and they are worthy of it, and they need to ask. And if they say, well, no, we don't do that, just say, well, no, you do, and we can find something. And they can be directed also to the major lung cancer advocacy organizations that do have online support, networks and groups. And there's no excuse for someone to feel alone in this diagnosis.
Definitely. And Heidi, could you describe your experience of having Pierre as your caregiver?
I am very fortunate to, again, have this wonderful soulmate for basically my entire life since I'm 16 years old. And one of the first things he started to do, Pierre loves to cook. He looked up like all the, what are all the benefits of certain, everything, nutrition wise for someone going through radiation and somebody going through chemo, and how can I prepare? And so it was almost like this nesting was happening, preparing for before treatment started. Pierre started to make all of these pureed soups and freeze them, because they said I'd have trouble swallowing because one of the lymph nodes was, basically sitting on my esophagus, and it was going to be very painful. And he made sure the house was clean, and he calls it a colonoscopy for the house. He had them come in and suck out everything from the vents, and just this most incredible care and love. And I just am so fortunate that and I credit my success with these treatments to him, making sure I was well fed and taken care of. And I did really well. I had minimal side effects with everything. And I think a lot of that, had to do with the care at home and Pierre balancing it all, still working full time as a primary care physician, taking care of other people, and then coming home and feeling as though, he couldn't stop, So I'm very grateful. And as things got better in terms of, my cancer seems to be at bay right now, and we became involved in advocacy, he has been the most incredible support in that as well. We are truly a team. And I am, again, grateful.
And a question for Pierre. How did you balance the roles of being Heidi's caregiver, but also her husband?
Yeah, I mean, that's a very good question. And I think what we've learned is that instead of me kind of guessing or each other guessing, what is it that you need from me? Because sometimes we were both off and that created some tension. We found that I think the best way for me was like, what is it that you need? So for her, for example, yeah, making meals and cooking, and it's something I can do, that was helpful. And as well as just because I had some medical background, she was not asking me to be her doctor, but it was, she wanted me to be involved with the care team. All right. Sometimes that's okay if some patients don't want that, but that's something they want. And then I think my role as a husband was ultimately also to let her know that and it was okay to say, I still need you as my wife. You know, you're not an invalid. I don't need to treat you like an invalid. And to communicate more my needs and balance the fact that, hey, before she was the diagnosed, I would tell her when I was upset or anxious about something. And right after she was diagnosed, I probably kept that in too closely. And the reality is that's really a matter of what we needed to do was to communicate. And again, a big plug for counseling. We're in counseling to help us with that, to sort of help us navigate how do you function as a couple and a caregiver. And again, it's with counselor, with someone who has experience with cancers. So that's what we're working on. And again, I ditto. She's the most important person in my life, and you know, that's the most difficult thing, right? She deals with I like to say kind of like existential anxiety, and caregivers, it's more this feeling, this which I had learned this new term, right? It's anticipatory grief, where you're grieving even though the person's right in front of you, right? And you have to be able to manage that, which is different than sadness. It's this very specific type of emotion, which I wasn't familiar with.
Heidi, you mentioned earlier that you were rather an introvert. So how did you, following your diagnosis, how willing were you to share your diagnosis with other people, and how did you approach sharing it with other people?
Yeah, so again, I felt very alone in this initially, and it was because there was no basically resource to find people. You know, they're not going to give you patient information. So I floundered around for a while, and by chance I met somebody in Colorado who was much younger than I was, and she was stage 4 and was doing quite well on a targeted treatment, and she knew some other survivors, and she organized a lunch, and we all went out to lunch one day. So it was like, yeah, July of 2019. And I met all these women who were kind of out there and telling their stories, and not ashamed of it, again, wanting to get lung cancer facts out there, that anyone could get lung cancer. And I'm listening to all these stories, and a lot of them young mothers. And here I am, in a sense, lucky, empty nester. I don't have to, take care of young children and have, kind of shepherd them through this. And I'm listening to these stories, and I'm thinking, gosh, our story is a little unique in that we were both trained in prevention, and we had very little knowledge. And if we didn't know that anyone could get lung cancer, why would I expect anyone else to? And these young women were putting themselves out there, and it started to feel very irresponsible to stay quiet, that our voices could be important, at least in our community. And then things evolved when we were trying to just get cancer centers to tell us or help us plan with them what they were going to do for Lung Cancer Awareness Month, which is in November. And after finding people here in Colorado who, these young women were very nice and doing things, trying to get a news story, whatever. They were getting tired of the same type of reactions, which were either being ignored or being told, oh yeah, that's a great idea, we'll get back to you, and just being dismissed. Or, eventually, in my case, just being insulted. And I just, cracked one day, became very angry. And I just thought, I don't have to ask for permission to do anything on my own property. And if Pierre made me, and I wanted it to be big, a big white ribbon out of wood, which I knew would sustain the elements, not be just like a piece of poster board or a piece of paper, could be out there. I could scream, at least to my neighborhood, that I had lung cancer. I wasn't ashamed of it. And gosh, if you want to know more, knock on my door. I'm happy to talk to you about this. And that just kind of went viral. And we started making these for people, and no charge, nothing. Because for me, if people wanted these, it meant that they were also ready to be vocal, and not even knowing anything about their lung cancer. I didn't know what stage they were, or what type, or smoking history or not. It didn't matter. It just meant, wow, more people want to talk about this and say they have it. Could this be the thing that, can help us break through this stigma? Just like it did in AIDS and breast cancer, the survivors stood up with the medical community and their caregivers and humanized these stories. And I thought, well, so much for being quiet anymore. This is happening, and people are wanting to tell their stories and challenge their cancer centers and for the things that they should be getting. Like, again, a support group, recognition on the Cancer Awareness Month, light the building up white like you lighted up other colors for other cancers. They are speaking out now. And I thought, gosh, I can't just back out now. I just have to keep going. So kind of found my voice in this 2 foot by 1 foot ribbon, a symbol, which was always there, but wasn't big enough or loud enough to make people, proud. I've heard people say the word proud. I'm not proud to have any disease, but I'm certainly not ashamed to have this one. And it just kind of felt like it naturally evolved that way. But all my life, and up until I was 55 years old, not so much. I mean, I didn't have to have a passion to advocate for something. I'm fighting for my life. I'm fighting for the lives of my children who can't get screened and grew up in a radon-infested house, my husband, and all of the people that I'm meeting now, 235,000 people diagnosed every year. Being quiet, again, does not feel responsible, and we need more people to speak up. It's not just about us. We need more physicians to take a stand. We need primary care doctors to do what they need to do and refer people for screening. This needs to become a very loud message it needs to be institutional messaging, and it isn't there yet. And so we'll have to march on as a grassroots organization, and are very honored to be talking with you today, because what you are doing is amazing, and bringing this to a younger generation to understand anyone with lungs can get lung cancer, having to re-educate people who have these deep ingrained beliefs. That's a lot harder. And if you can stop it there, and you have your generation to teach the facts now, we can change the course of this disease for people in terms of screening, early detection, all the way through research and treatments, and survivorship. Survivorship has never been promoted in lung cancer. We're demanding it now because we are living, and we want to continue to live our best lives, and we need the tools. So
it's just so inspirational to hear both of your advocacy work, and we're so thankful for your efforts. And we mentioned this earlier, but Heidi and Pierre are the co-founders of the White Ribbon Project, and they're doing phenomenal work and helping create these white ribbons and build a community to support lung cancer individuals and anyone who wants to support. So, just thank you again for your work. And you mentioned before that lung cancer was never on the radar and you had little knowledge of lung cancer before. So do you have any misconceptions about lung cancer prior to being diagnosed, or any concerns about lung cancer screening or anything like that?
Well, in my situation, I mean, I grew up in a family where there really wasn't any cancer. And members of my family, uncles, aunts, and so forth, people were suffering with heart disease. And so I led this life of prevention. I don't want to have a heart attack at a young age. So I'm going to eat clean and exercise and learn all I can, and then go in for all the preventative screenings, right? So pap smears, cholesterol checks, colonoscopy once I'm a certain age, mammograms, never forget, to do that, because we're all told we're going to get these cancers. So you need to screen for them. And I never, ever heard anything about lung cancer, because it was taught for 60 years now that if you don't smoke, you're not going to get lung cancer. So it really wasn't something I thought about at all until sadly it happened to me. And yeah, certainly a wake-up call to, and again, initially I thought I was an anomaly because I was in the head spinning stage and just trying to get through, like, what's the treatment plan, and how do we prepare, get the meals prepared as Pierre was doing, in the house ready, and all this, and kids flying in for what was going to be mom's last Thanksgiving or Christmas. I mean, all of this kind of, just wanting to make sure we did things right, that, I just wasn't thinking about, gosh, there must be other people out there like exactly like me. And then when I met those women at that table at the restaurant in, July of 2019, I realized, whoa, and look how young they are. Let's dig a little deeper, and learning, that this is a climbing number of young people who, with healthy habits and so forth, getting not only lung cancer. That was the other thing I dealt with. Not only was it lung cancer, but it was late stage. So, and no opportunity to be screened. So that needs to change, and research money needs to go into treatments, absolutely. But it also needs to go into a more practical screening method that could be universal. Let's say blood or saliva or breath, or something that is practical. And then if something, if there's family history and in conjunction with an odd result, then you get a CT scan. And then those who are eligible really need to be encouraged and aware of this is available to them. They have a right to it. And don't be afraid to do it, because there's so much hope now. So much hope.
Yeah, I just want to jump in that I agree with Heidi that more research is needed for all sorts of cancer screening tests, right, including lung cancer. But with lung cancer in particular, we have millions of people who are eligible, right? And you all know this, the screening rate is less than 6%. I think the average screening rate is less than 6% in the United States, certainly less than 10%. And in some states, it's abysmal, right? You're in the 1%, 2% of the eligible population. And it is probably the lowest hanging fruit in order to increase survival rates. And the guidelines, evidence-based guidelines, large randomized control studies, as you're all well aware, were published over 10 years ago with a recent update, right? So to me, I think the biggest gap that primary care physicians have, and maybe physicians in general, is I think many of them perhaps overestimate the risks of the tests, meaning that, oh, you're going to have false positives and that may lead to other procedures. And perhaps there's also some stigma associated. Well, I'm not going to work as hard on screening these patients with a history of smoking because, frankly, perhaps, there's less empathy for them. So for me, I want to do whatever I can to rid the physician population, particularly primary care physicians, of the notion that they are absolved of the responsibility to close that gap. They play a very important role in encouraging lung cancer screening to their patients. If they're vocal about promoting breast cancer screening, then there is no excuse for not promoting lung cancer screening, right? Which has the same rating from the United States Preventive Service Task Force. So that's one issue. And the other issue is to not exclude the possibility of lung cancer in someone who doesn't have a history of smoking, right? It's not that rare. I mean, and most primary care physicians know that men can get breast cancer, I would say, but it's about 2,500 in the United States, where people without a history of smoking, you're now upwards of 20 to 40,000 being diagnosed and increasing. So we know so many people who presented to their doctors, with all sorts of persistent symptoms way beyond 4 weeks, months of a chronic cough, of other symptoms. And they really didn't follow even other guidelines, those by pulmonologists, chest, to get a chest X-ray, because they just assumed this is a young person, a young woman in her 30s without a history of smoking. They didn't include lung cancers in the differential diagnosis. And so all I'm asking primary care physicians to do is look, know the facts and don't exclude this diagnosis, particularly in the right circumstances. So 2 things: screen your eligible patients, tell them the facts, don't make up facts, don't make up facts about risks and benefits, go through an informed decision-making process. But as I know, patients really rely on their physicians. If their physicians don't really recommend something or don't promote it, they're unlikely to really follow that advice. They just are. So that's definitely one lever. The second lever is what you all are doing, which is kind of trying to, how do we integrate evidence-based data into other ways of informing the public? Because the other way patients come for screening is they come to the doctors and say, hey, am I at risk of, I read something about lung cancer screening, am I eligible? And as a caretaker, if you love someone or are close friends with someone who may be eligible for lung cancer screening, or they're eligible and those people don't want to do it, perhaps this is your opportunity to maybe encourage them to do so. If you're encouraging your friends and loved ones to get breast cancer screening if they're eligible, do the same thing if you think they're eligible for lung cancer screening. Worst case scenarios, you can just tell them, well, you may be. You have this history of smoking. I don't know if you're eligible, but go see a doctor. And if also they have, but also partly to diminish the stigma is to sort of keep on saying, hey, anyone can get lung cancer, and if you have persistent symptoms that concern you, and don't discount the possibility of something bad that could be happening to your lungs just because you've never smoked.
And I think in terms of, general population and people who are eligible, who don't know they are eligible and so forth, can you imagine, okay, right now, lung cancer is the #1 cancer killer. It's very prevalent, but it's what the second most prevalent cancer. But if only 6.5% of eligible people are getting, the screening and diagnosed, can you imagine if we got that percentage higher? If we were screening 30%, 40, 50, gosh, where it should be, 100%. I think the prevalence would wipe out all of the other cancers in terms of prevalence added together. I mean, look what it is now with only, a small number of eligible people being diagnosed. And I mean, going for the screening and hopefully getting diagnosed early. And then for people who are not eligible, boy, are we lucky if we get caught early. I mean, we have very little chance to get caught early. It's primarily late stage diagnosis for people who don't have, and it's just odd to me to think that any other organ is perceived, even by the medical community, as, vulnerable to a cancer. But for some reason, we think lung is only vulnerable to a cancer if the person smoked and, smoked cigarettes. So that seems strange when we know that smoking is related to basically every cancer out there. Why is it only promoted through institutional messaging as smoking equals lung cancer? It doesn't, it doesn't increase the risk for other cancers. That's not true. That's not true. And so again, promoting the facts is very important to help, get rid of this stigma. It's anyone can get it. Anyone who smokes can get it. Anyone who doesn't smoke can get it. Not everybody who smokes gets lung cancer. I mean, this doesn't have to be this way.
Completely agree with what both of you said. And I think, like you just mentioned, unfortunately, there is a stigma around lung cancer that we need to move away from, that there's a strong smoking association between smoking and lung cancer, which makes people shocked to hear that never smokers can get lung cancer. And it's upwards of 10 to 20% of individuals diagnosed with lung cancer are never smokers. So it is a big portion of individuals diagnosed with lung cancer. And right now, the screening rate for lung cancer in the US is 5.7%, which is extremely low compared to screening rates for breast and colon cancers and these other cancers that have screening recommendations by the USPSTF. And for breast and colon cancer, screening rates are around 70%. And so it's really worrying that the screening rate for lung cancer is only 5.7%. I know we can do better. And right now, screening is only recommended for individuals with a heavy smoking history. But as you both mentioned, there are other risk factors for lung cancer that can maybe cause lung cancer in those who don't smoke, such as exposure to radon, exposure to asbestos, a family history of lung cancer. So I completely agree. I think it's just extremely important that we find a way to help identify individuals who might be at high risk and don't smoke. And this might be through more research that helps us build better lung cancer prediction models, or just informing doctors and primary care physicians that to at least bring up this conversation with individuals who might be at higher risk for a variety of other reasons, and just starting the conversation about lung cancer and lung cancer screening. I think that can be extremely helpful, because lung cancer screening can reduce mortality rates, and I think is an area where we can really improve on and save a lot of lives by doing that.
And Pierre, as a retired primary care physician, what do you believe is the best way we can educate primary care providers about the lung cancer screening guidelines?
Right. I think, number one, most primary care physicians now function in institutional settings, right? It's either a university setting or large medical groups, integrated delivery systems. And for those physicians, I believe that it's the responsibility of those institutions to hold and promote continuing medical education for those physicians. I believe that it's also important for the medical boards to start addressing lung cancer and lung cancer screening a little bit more aggressively in the questions. So kind of heads up to physicians, you're going to be asked about lung cancer screening. And the other is because the guidelines are more complex. It's more than just age and smoking history. You have to calculate how many pack years people have, and then they have to have quit within 15 years. And there's all these other variables. I think that we have to be able to leverage either electronic medical records or support staff to provide physicians, primary care physicians, hey, here's a list of your patients that are eligible. And we're contacting them and they're going to come to you. All we're asking you is to sort of say to them, hey, I encourage you to get lung cancer screening. You're eligible, and flag that. So I think there's a lot of tools in that sense. For other physicians who are in smaller private practices, most of them admit to hospitals. So I think it's the local hospitals that should promote those continuing medical educations. And then again, I think the American Lung Association, the American Cancer Society, the CDC, all of these large local public health departments need to be much more aggressive. Again, most of the time when I was in practice, patients came to me and said, I want my colonoscopy. I want my prostate screening test. I want my pap smear, because that information was just so public. It's common knowledge now. And I just feel that we need to get to that point with lung cancer screening. And what you're doing is helping. I think that this push to include information on cigarette packaging is certainly something along those lines, where how do you get information to people who are at risk?
So Pierre, being a primary care doc for the years you worked, you clearly gained a lot of experience and knowledge along the way. So how did you balance not excessively interfering with Heidi's treatment, being a primary care doc, knowing what you know, while also saying, hey, I have some experience and I can try and help you along the way? How did you balance the two?
Yeah, that's a good question. It's something that I think remains challenging for anybody who's in the healthcare field. I think clearly there are, in my institution, there are guidelines. There's like, you do not treat your family members, and got to the point where you don't prescribe antibiotics for your child's earache, and so I wasn't going to manage it. The tougher issues for us, to be honest, and here's a classic example, is she would inform me of some symptom she was having, and initially I knew I'm not objective, right? Like, what would I tell my own patient if they came to me? I would say, go to the emergency room or go this. And in her situation, she says, look, just tell me, what do you think, right? I mean, I just want your opinion given your fund of knowledge. I'm not asking you to treat me. I just want your honest opinion. And I will be, responsible for the decisions I make. And so it is a balance. I know that I can't treat her lung cancer. On the other hand, I think I can be your advocate, just like someone without a medical education can be an advocate, right? How many times have I had someone come to my office? I have a patient with diabetes, and they've got their patient advocate, it could be a family medical, and they're giving me articles about new medications, things of that sort. That's all appropriate, as long as they're not playing the doctor. They're not necessarily telling the patient, this is what you should do, not what your doctor is telling you. They're just coming with questions. And that's what I try to do, is sort of say, or I try to, if her doctor said, well, this is not really evidence-based medicine to do this. And I say, of course, we understand that. We're not doing it necessarily for that reason. We're asking to do this because it helps relieve our anxiety, be it, getting a scan a little bit sooner than what the guidelines are. And so we have this discussion with the physicians. Again, it's a shared decision-making process, right? We're not trying to direct her care. We're just working with her physicians and just saying, hey, this is how we feel. What do you think? And these are our concerns. And so far, that's worked. We've found physicians, for the most part, who are willing to work in this shared decision-making process. And that applies right now to, some of your audience may say, well, look, I don't qualify for lung cancer screening, but my mother died of lung cancer, and I have all these other risk factors. I'm a firefighter, and I live in a house with high radon for years, and the CDC says it's the second leading cause of lung cancer. What do I do? I say, go to your doctor. And what I tell the primary care physicians is like, look, yes, the guidelines say that that the population doesn't qualify for lung cancer, but it doesn't mean you can't have a shared decision-making process. It's not illegal for you to order a screening test. It's just, you have to make it clear to the patient, look, you don't necessarily qualify for that. So let's talk about what may be reasonable for you. It could be, look, let's just hold off. You don't qualify. I think your risk are mitigated. Or it could be, yeah, maybe we do order a scan. Insurance is not going to pay for it. I want you to understand you don't qualify. These are the risks. But we are, you're working in a gray area. But that is, we do that. Physicians do this all the time. Shared decision-making when there's not enough information to know exactly what the right thing is to do. You shouldn't do something that's dangerous or contraindicated, right? You should always follow guidelines, but guidelines do not help you in every single circumstances. And so that's what I want to be clear. We're not promoting screening people who do not qualify. For those people, but think to have their risk is to talk to their doctor about their concerns and have this shared decision-making process about what may be the appropriate thing to do at an individual level.
Well, we haven't had a caregiver who was also in the healthcare field in our podcast before, so it's a very, very different and really helpful perspective. And one question that I wanted to ask was to both of you, Heidi and Pierre, what do you believe are the current challenges that the lung cancer community faces?
Yeah, so obviously the stigma is difficult for people, and you get diagnosed and the first thing comes to mind is like run and hide. And we have taken a big step with trying to change the public perception of lung cancer with the White Ribbon Project, getting people to tell their stories. And what I think that it seems as though at times it's presented as, well, these people didn't smoke, so they get more empathy, and maybe we want to fund a little piece of the pie for like this, maybe a subtype, a mutation group or so forth. And what I want people to understand is those are smaller numbers. And as a community, if you look at 235,000 human people, these are people who have families, people who love them, they give love and so forth, that their lives matter too. We need to be unified and stand as, and speak with one voice, that everyone, whether they smoked or not, is entitled to be, good care, and to not, blame anybody for anything. We're blaming people for addictions where they were victims of predatory marketing. And we are watching this happen again with vaping. And we can do better. And kind of a personal story here is the Go-To Foundation has a phone buddy program. And as I started to become involved in advocacy, this was long before the White Ribbon Project, they would try to match you with somebody with the same diagnosis and treatment plan, so you could be that support to them. And so I was hooked up with Bonnie, and this is Bonnie, and we became like best friends. And Bonnie and I were both diagnosed with stage IIIA lung cancer, adenocarcinoma of the lung, inoperable, chemoradiation, and then immunotherapy. And I'm sitting here today, and my friend Bonnie, she died on May 17th. Bonnie smoked, and she quit smoking many years ago, but she did qualify for screening. She went in for screening in 2007, was caught with a stage 1, had her surgery, and did not pick up another cigarette. And then in 2019, got diagnosed with the same exact cancer that I have. So what difference did it make, really? We were both really good people. We love our families. She's sorely missed now. Her family is devastated. And Bonnie smoked. Bonnie deserved the same care that I got. I got the same care she got. And unfortunately, it didn't work out for her. And I'm grieving. And I'm grieving for this community, because I want to see them stand up and not point fingers at, well, my cancers need to be, recognized more because it's a certain type. And, I didn't ask for it. Well, no one asked for this. No one.
Yeah, just to be clear, but Bonnie probably got many years of quality of life because she was screened. So I don't want the audience to sort of think, oh, she got screened and she's still getting it. she was diagnosed early stage and remained, recurrence free for many years. But Heidi's point is well taken, is that in the end, it doesn't really matter what her smoking history was. They bonded quite close. And then the other thing, what is the most challenging thing about the lung cancer community? I think what we're learning is that it's the lung cancer community itself, is that we need to organize just as the breast cancer community did, the AIDS community did. They didn't sort of wait for others to save them. Okay, they organized and they worked to achieve what they deserved, which was more attention, more research money, and better care for themselves. So,
yeah, if we're not going to do it, no one's going to do it for us. And that's the same recipe for the other cancers and for AIDS, HIV. I was part of that community, and we stood with those patients and caregivers, and the medical community made it clear that anyone could get AIDS. And then it became a priority. And when people know, it's just getting the stories out. I mean, it would be great if the institutional messaging would change. That would be the responsible thing to do. But like I felt that day when I was, insulted by a cancer center, how long am I going to wait for them to change their message? I may not be here by then. I am fighting for my life. I'm doing well now, but that could change in 5 minutes. I mean, I want to know there's another line of treatment if I'm to, if it comes back. So, this is our time to get organized. We are living longer, and be responsible and understand that we have voices that are important to be heard, and we need to be seen and heard, and we can get this done. We can. I'm optimistic about it.
Thank you for sharing that story. It's extremely powerful and it was really moving. If you had a couple tips, what advice would you give to someone who's newly diagnosed with lung cancer?
No, there's hope, and they do have to become their own advocates. And I would strongly suggest that they do get connected to some of the larger advocacy organizations to learn more. There's the Lung Cancer Research Foundation, the Go-To Foundation, Longevity, Lung Cancer Foundation of America. I mean, there's a lot out there. And I had no clue that those resources were there. And they can help them, even, get a second opinion if they're concerned about, where they are. And I think everybody should get a second opinion and learn about, biomarker testing. That's a whole other issue where some cancer centers aren't really doing it. And some are only doing it if it's stage 4. And now we're finding, well, maybe that's not the best way to go. And they can help them, advocate for themselves and give them the tools to do that. So to get connected, and the White Ribbon Project helps people. We help people find those, those organizations as well. We connect them. We don't, we can't do what they're doing. They do amazing things. And we're about, being vocal and visible and to help people find their connections.
I think that wraps up our questionnaire, but thank you so much, Heidi and Pierre, for taking time out of your day to share your story with us. It's so very inspiring to hear about your role in raising awareness in lung cancer and also hear a little about your story. Now I would like to open the floor for our participants to ask you any questions they may have regarding you or your story, and if you feel comfortable answering them. So if you guys would like to ask Heidi or Pierre a question, please feel free to put it in chat or in mute.
I have a question from the audience. They ask, looking back at your journey, is there anything you would do differently or wish you knew?
Well, I wish I would have known that I was not alone right away. I wish that someone would have met me where I was initially and given me, let's say, literature on the advocacy organizations from the Cancer Center, that I would have been able to find support right away and know that those things are out there. And to not feel alone, because boy, we are the number one. There's a huge community out there.
Thank you. I have another question from Spencer. He asks, who in the lung cancer community inspires you most?
There's so many. Again, I'm very inspired by some advocates who are been very vocal and long-term survivors and have been doing incredible work in learning the research and learning how to advocate for better outcomes for people and really become ingrained in the science community and are very, very well respected. The pioneers in these advocacy organizations, Bonnie Adario, Chris Draft, who's been just an amazing, he was a caregiver and lost his wife and has been a relentless leader in lung cancer advocacy for over a decade. It's a mountain of work that these people have done. They've just been truly trailblazers,
So I received a question from the audience, I think for Pierre. As someone with years of experience as a healthcare professional, how would you describe the growth in lung cancer advocacy efforts in the past 10 to 20 years?
Well, I'm not an expert in lung cancer advocacy, but what I would say is I'm surprised about, I guess, the lack of visibility of lung cancer advocacy organizations to people who have not been immediately affected by lung cancer or to physicians who don't necessarily treat lung cancer. I think we are seeing within the past few years, largely because of better treatments for lung cancer and perhaps even because of more awareness of screening, that lung cancer advocacy is gaining momentum. But I would say that despite a slow start, there's hope that we are now at a tipping point, perhaps in broader awareness of lung cancer advocacy, broader engagement in lung cancer advocacy, and most importantly, greater success in the efforts of advocates.
And I have just a personal question that I want to ask Heidi. What is one word that you would use to sum up your lung cancer journey to date?
Wild. It's been a wild ride. And
I would, you can describe the experience, what I've noticed in her, it's been transformative. And it's not anything, obviously, that I would have wished upon her or that she would have wished upon herself, but it has led to changes in her outlook, changes in, I think, her ability to feel that there is an opportunity to make some good out of this. It doesn't negate the negatives, and again, never would have wished it upon ourselves, but she's a amazing woman. I'm so proud of her. It was a transformational.
yeah, another word, just grateful to have this opportunity to get a drug that was just at a trial and be able to have the strength and courage to step out of my box and do something that, helps me maybe cope with, like, how did this happen? Why did it happen? Cliche, making lemonade out of lemons, and a lot of it, a lot of lemonade.
It seems like this wraps up our Q&A session. So again, thank you so much for your willingness to share your story and perspective on many of the pressing issues in the lung cancer community. We really appreciate the work that you're doing to help raise awareness about lung cancer.
Thank you.
Well, thank you.
And thank you everyone for joining our podcast. Please keep an eye out for our upcoming podcasts and events, which will be listed on our website, www.alc.org. We also encourage you to join our monthly newsletter where we will share updates on upcoming projects within our organization. Please fill out this form in the chat if you'd like to be added to our mailing list. And we also would like to offer a brochure highlighting some key information about lung cancer and lung cancer screening. So if you find this helpful or know someone who might benefit from the information included in the brochure, feel free to share it. And thank you and have a great day, everyone.
Thank you.
Bye-bye.
Thank you, everyone.
Bye-bye.